Right, moving on. Amid fears of the fourth wave of COVID-19, Prime Minister Narendra Modi will interact with Chief Minister today via video conference. PM Modi will chair the meeting to assess the COVID situation in the country, the preparedness of the healthcare system and the status of the vaccination program. As the country witnesses an uptick in COVID cases, Delhi, Punjab, Haryana, Uttar Pradesh, Karnataka have reimposed the mask mandate and appealed to citizens to maintain social distancing at public places. Dr. Ishwar Gilara joins us on the program to talk more about this. Dr. Gilara, very good morning to you. I hope you can hear me.
Good morning. Good morning. Good morning.
Well, the Prime Minister is concerned. He's summoning all the Chief Ministers to make sure that the preparedness for perhaps the next wave is in place. Are we in danger again, Dr. Gilara? What's your assessment?
Basically, what meeting is happening is the once bitten, twice shy kind of scenario. We are not in any danger. What Honorable Prime Minister should do and ensure now, because there are a number of vaccines approved for the children population, 5+ population. They should ensure the fastest possible immunization of children. And for that, apart from the current agencies which are doing or current centers which are doing vaccination, they should involve the pediatricians, because children have a rapport, or parents have a rapport with pediatricians. And there are close to 2 lakh pediatricians in the country. So in that situation, if they are involved, if nursing homes are involved, if smaller clinics are involved, then the immunization can be done faster. So I think currently it is a lackluster response to all the immunization, whether it is a 60+, whether it is a 18+, in the private sector, or it is 12+. 5 to 12 is yet to start. So having different agencies in the country, one agency decides but the other agency sits on the decision, and therefore it is not yet approved whether 5 to 12 will receive vaccine or not, despite Drug Control General of India approving 2 vaccines, Covaxin as well as Corbevax, for the children population. So that is one thing. Second thing, we should look at the narratives of how many people are requiring oxygen, bed, ICU, ventilator, and what is the death rate. Currently, the death rate is around 0.1 to 0.2%, which is a case fatality rate, which used to be around 2.1%. It fell down to 1.3% for a long time, and now it has come down to 0.1% or 0.2%. Whatever number of deaths we are seeing by number currently, most of them are from Kerala, and they are readjusting the figures. I spoke to Kerala people yesterday, and they said that they are every day readjusting the previous deaths. But pan-India, particularly in Delhi also, if you have 1200 cases or 1000 cases, there is 1 death. In Maharashtra also, hardly 1 death alternate day or something like that. So deaths pan-India are very less, and therefore we should be bothered, but we should not be panic about whatever is going to happen with the number of cases. Secondly, number of cases are not going to exponentially high, because 90% of us had at least one infection, and therefore we have a natural immunity. And plus there are 78% of the population has been almost fully vaccinated. So in that situation, we have 85% of us having a hybrid immunity, and 95% of us have at least some immunity. So vulnerable population to get new infection is only 5%. Only possibility is that newer variant come, which is more severe, it is like Delta, then we are worried. But otherwise, with the current variant or manufactured variant of Omicron or sub-variant of Omicron, nothing is going to happen to us. I think mask mandate is not required. Masking in closed door places, in public transport, it is required, but there need not be a mandatory or charging people with some kind of fine. It should be voluntary, and people should also do some voluntary action on their own.
Dr. Gilara, when the third wave was coming to an end, there was this conversation, there was this speculation about, this being the endemic stage. To reaffirm from you, are we still in that endemic stage?
Actually, we are on part 2 endemic stage. We are just overcoming this third wave and the Omicron wave, and barring few instances here and there, the cases are very few. At the same time, even testing is also few. So in this case, when the numbers are escalating, we should wrap up the testing, and we should do more genome sequencing to find out whether they are newer subvariants or like BA.4, BA.5, which are likely to be little bit 10 to 20% more infectious than the previous BA.1, BA.2. So in that situation, endemicity is round the corner. However, is a global village. If the rest of the world is not fully vaccinated, particularly Africa, then there will be new variants manufactured there. and they will travel to India also. So therefore, we should also ensure that the entire world is vaccinated to optimal possible level.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.